So now we will introduce our next speaker, Dr. Samina Khalil, who is qualified as a doctor from the University of Liverpool and completed a GP training in Bradford, and currently works as a freelance GP across practices in the West Yorkshire and around the Bradford area. Dr. Samina Khalil has a keen interest in geriatric medicine and, in particular, raising awareness of depression amongst the elderly. She leads the Muslim Health Service project and, in particular, the Community Companions project, which deals with uh, reducing the social isolation and loneliness in those people over the age of 65 years old in the area of Bradford. So let's hear what Dr. Khalil has to say about the elderly and mental health.
All praises to Allah, the most beneficent and the most merciful. Salutations and blessings upon our Master Rasulullah sallallahu alaihi wasallam. My dearest respected Shaykh, elders, brothers and sisters, Assalamu alaikum. My name is Dr. Samina Khalil. I'm a GP in Bradford and the surrounding regions and the project lead for Muslim Health Services Community Companions project, which aims to reduce social isolation and loneliness in the elderly. Today I'll be talking about mental health in the elderly. I'll start with a brief discussion of what the term elderly means, some of the causes of mental health in this population group, and in particular we'll be discussing one of the most common mental health problems, depression. I'll also briefly discuss the Islamic perspective of looking after our elderly. So when we look at mental health, it's difficult to isolate this from a person's physical and social well-being and background. It's important for us to put the elderly person into context. We have to look at their background, what era they were born in, and what significant life events took place. Often the elderly we see now are those born post-World War, in a time of recession when the use of computers, internet and air travel was just starting to flourish. So I'd like to begin with getting you all to think about what the term elderly means to you. Quite often in Western cartoon depictions, it's a grey-haired, wrinkly skinned, hunched backed old man or woman in their nightgown or slippers. But this depiction of elderly varies from community to community. In Islamic depictions, it's often a very noble, graceful looking elderly man with a white hair and long beard, often wearing a turban, surrounded by lots of people looking up to this elderly person with admiration and as a fountain of knowledge. In fact, in some countries, as you get older, you are given the title Sheikh out of respect and honour. It's difficult to define a cut-off for elderly, the reason being that 86-year-old may be running the London Marathon, may feel as fit as a fiddle, whereas a 56-year-old with lots of different medical problems may feel very old and frail. The saying that you are the age you feel is very true. But there has to be a cut-off somewhere, and as such the World Health Organization accepts the Western definition of an elderly person as someone over the age of 65 years, or roughly the age at which a person becomes eligible for state pensions. But like many westernised concepts, this age classification doesn't adapt well to the developing countries, where they may have their own cultural definitions of what's considered an elderly person, for example having grown up children and grandchildren, or the point when active contribution is no longer possible, or loss of roles accompanying physical decline. So growing old means different things to different people from different cultures and backgrounds. As a society, yet we are obsessed with trying to stay and look young. You only need to switch on your TV or pick up a magazine to see or read adverts on anti-aging serums, anti-grey hair dyes, and anti-wrinkle creams. But the inevitable thing is that the aging process is a biological reality. And no matter what differences in genetics, lifestyle, and overall health we all have, the reality is it'll affect each and every one of us, be that in 10, 20, or 30 years' time. So we're seeing increasing numbers of the elderly population today, partly given the advances in medical sciences, better diagnostic techniques and treatments, and the push towards promoting healthier lifestyles means people are living a lot longer than they did, for example, in the 1800s when the life expectancy was much lower, around 40, 50. In the UK, there are 12 million people over the age of 65, and in the area where I work, Bradford, there are well over 70,000 elderly people. That's almost 1 in 5 people in the UK is an elderly person. And amongst those elderly, 1 in 5 of them have mental health problems. So 20% of the elderly population have mental health problems. So the figures are quite staggering, really. Mental health is very, very common amongst the elderly. The most common mental health problem in the elderly is depression, followed by dementia and then anxiety. Then there's things like substance abuse problems too. These are often overlooked in the elderly. On the severe end of the scale, we see delirium, late onset schizophrenia, and even self harm. Elderly people are susceptible to these due to the neurobiological changes associated with the aging process. And it may also be due to the prescribed medication that they're on or genetic susceptibility, really, that may cause these mental health problems. So, as you've heard through the course of this Oshri weekend, there's multiple risk factors for mental health problems at any point in life. And older people may experience life stresses that are common to all of us, but there's also stresses that are more common in later life, like a significant ongoing loss in capacities and a decline in functional ability. For example, older adults may experience reduced mobility, chronic pain, frailty, or other health problems. Studies have shown us that those with chronic health problems are more likely to suffer from depression, in particular those with heart disease. Untreated depression in an older person with heart disease can negatively affect its outcome. In addition, older people are more likely to experience events such as bereavement. They may lose a spouse or friends, families similar age to them, and this may only reinforce that they too are approaching death. There may also be a drop in their socioeconomic status with retirement. All of these stresses can result in psychological distress, isolation, or loneliness in older people. Unfortunately, older people are also vulnerable to elder abuse, and sadly, we see physical, verbal, psychological, financial, and sexual abuse. We also see abandonment, serious neglect, and serious losses of dignity and respect. In fact, current evidence suggests that 1 in 6 older people experience elder abuse. This doesn't just lead to physical injuries, but also, sometimes long-lasting psychological consequences, including depression and anxiety. So, with depression, feelings of loneliness and being socially isolated are the biggest risk factors to mental health and functioning. Studies across the world have suggested that elderly living alone are more likely to be depressed and have a poorer quality of life compared to their counterparts. That's 1 in 5 elderly people. That's for every 5 elderly people, one will be depressed. We are increasingly seeing this in today's society as shifts in social dynamics towards denuclearization of a family unit means more and more elderly people are living alone as their all adult children are living in either different parts of the country or even a different country altogether. Loneliness in the elderly occurs when there's a difference between the perceived and expected amount of support an elderly person receives from their families and especially their adult children. So while living alone is an objective measure of one's living arrangements, loneliness is a subjective emotional experience of one's personal relationships. So depression is more so important in the elderly as they may present differently to the younger generation. They often underreport their symptoms and their feelings of sadness are often minimized. At their age, the focus is mainly around their physical health and often they may not be asked about their mental health or this may be overlooked. Talking about how they feel or their mood may seem like they're wasting a doctor's time. It's more so a taboo subject with the elderly population, by admitting that they're not able to cope or may seem like a sign of failure for them. Or they may fear ending up in a nursing home and losing their independence even more if they admit to the fact that they're not coping very well. So depression in the elderly can therefore present with hypochondrial worries, their speech being more slow, biological symptoms such as poor appetite, insomnia, and changes from their normal behaviour. But the key symptoms of depression, how we diagnose clinically, is persistent sadness or low mood. Now, any major life event would make us sad and upset, but that doesn't mean we're all depressed. It's a normal human reaction. It becomes abnormal when this bereavement response becomes a persistent sadness, a persistent marked loss of interest or pleasure in doing things for most days for at least 2 weeks. Sleep and appetite are affected, fatigue or loss of energy, agitation or slowing of movements. Now, often all these symptoms are put down to part and parcel of growing old, making it really difficult to sift out those patients who are actually depressed. Other symptoms include poor concentration or indecisiveness, feelings of worthlessness or excessive guilt. In severe cases, we see self harm ideas and sadly suicidal thoughts as well. Now, there are effective treatments for depression, and current guidelines suggest antidepressant medication, along with support, psychoeducation, and active monitoring, as well as further referrals to psychiatrists for assessments and interventions too. So, even though severe mental health in the elderly at times requires expert care, medication, sometimes sectioning, and admission to a mental hospital, that's not to say that we as a society, community, individuals can't play our role in helping support those on the milder spectrum of anxiety, depression, low mood. In some communities and under the influence of traditional values, adult children are expected to support their parents financially, physically, and emotionally. However, with the advent of care homes and nursing homes, coupled with the fact that we are living in a capitalist world where we need to work all hours, we are increasingly seeing a growing trend in favour of these care homes rather than a nuclear family unit. And also, sadly, our society no longer values the elderly, as they're no longer capable of playing an active role in the workforce. They're no longer paying taxes and, in fact, are actually on the receiving end now. As doctors, when we see elderly people sat alone in their homes with only the TV as their companion, not having interacted with a human face for weeks on end, it's absolutely heartbreaking. Quite often, as GPs, we've seen elderly people resort to saying things like, "I'm just waiting to die now." So the question we've got to ask ourselves is, who's failed and neglected these people? Whose responsibility are they? Is it their friends or family, if they have any? Is it social services, or is it the government? Or is it us as individuals who are part of their community or society? Islam teaches us to take up the responsibility to care for our elders, as they have a protected and dignified status in Islam. There's a strong emphasis in looking after elderly throughout the Holy Quran and Sunnah, but this is contrary to what we currently see in society as people move further and further away from the adherence of Islamic principles. Allah Almighty states in the Holy Quran, "Your Lord has decreed that you worship none but Him and be kind to your parents." Your Lord has decreed that you worship none but Him and be kind to your parents. Now let's just take a moment to think about this. The whole essence of Islam is monotheism. Yet with such a powerful statement of not committing shirk, it is immediately followed by Allah Almighty instructing us to be kind to our parents. This should show us the sanctity of our parents and the importance of how we behave towards them. Islam also recognizes the physiological and psychological changes in the elderly and acknowledges a number of weighty religious and spiritual dimensions corresponding to old age. For example, a closeness to Allah Almighty, acquisition of wisdom, and increase in honourability as a person ages. So whilst it's true that all elderly deserve our respect and kindness, children have a special responsibility towards their parents. And if the elderly have no children, then it falls upon society to take care of them. And if parents are no longer alive, then again there are clear Islamic principles that encourage us to do 4 things as our duty towards our parents. That's praying and asking forgiveness for them, fulfilling their pledges, being kind to their friends, and maintaining the ties of kinship that only come from their direction. But when it comes to elderly who are depressed, we can in particular play our part by ensuring that they are not lonely or socially isolated, the 2 biggest risk factors that lead to depression. So be that our parents or any elders in our society, community. In Islam, we are actively encouraged to visit the sick, and there's lots of reward for this. And also, we've given clear guidance by Allah Almighty on how we should communicate with the elderly. We should speak to them with respect, kindness, and gentleness. And when we visit them, we should speak positive words of Allah's mercy and treat them in the best of manners. Elderly who are in this manner will hopefully feel empowered and important. They'll develop meaningful relationships with people that will ultimately reduce their innate feeling of loneliness and social isolation. In Bradford, Muslim Health Service, in partnership with Mind in Bradford, have set up a community companions project where we recruit members of the community to volunteer a bit of their time to go and visit the lonely, isolated elderly people. This by no means is the only solution, but it's a step in the right direction. But we need to do a lot more to ensure the elderly in our society receive the respect and dignity they are worthy of to achieve sound mental health. So, in conclusion, we've discussed what an elderly person is and how a number doesn't define how old you are. Elderly people we see now are living in a fast paced, technology filled world, completely different to the one they lived in and know of. Mental health is more common in the elderly than we think, and often we put this down to just growing old. It's important to talk about mental health and not shy away from it, and we've discussed some of the causes of mental health specific to elderly people. As a community, we should strive to remove those barriers and enable the elderly to do all the things that we can do so that they can live independently for as long as possible. We've also discussed the importance Islam places on looking after and serving the elderly, be that in our homes or the wider society. So let's start by visiting the elderly in our families, our streets, our neighbourhoods. Let's speak positively to them and lift their spirits quite literally. Let's seek their company and talk about their experiences and gain from their wisdom. May Allah subhanahu wa ta'ala grant us all the ability to look after the elderly in our communities, to love and respect them in the manner that they are worthy of. Wa akhiru da'wana alhamdulillahi rabbil alameen. Assalamu alaikum.
You sure it's ready? That was Dr. Samina Khalil talking about the elderly and mental health. And alhamdulillah, we as Muslims are encouraged to treat our elders in a very good way, to look after them, to do their khidmah, to serve them, to ensure that they have what they need. And in return, we seek their du'as, their guidance, and their supervision.